Okay, it's time to take a close look at your skin, folks. You ever wonder about scars? Is there a way to make them go away? How about that? Well, Dr. Jorge Garcia is here from Apex Skin, 11 locations.
Yes.
So, are you still in the Air Force? Or you were in the military?
I used to be in the Navy flight surgeon.
Navy flight surgeon. You must fly around to get to all 11 places.
Yeah, no, not yet. We still drive.
Now,
Thank you.
okay. Hey, so today we're talking about scars. Scars are an interesting thing because they're a result of something that happened to you. But people don't always like those scars when they have them, do they?
Exactly. So, as you know, the skin is the largest organ of the body. So, you know, you form a scar whenever you have an injury to be a trauma, burns into the skin, and the body kind of repairs itself naturally by forming a scar. Usually, a scar is basically your protein called collagen. The body.
It's a good thing, really.
It's a good thing. It's a natural progression of wound healing. So, you know, a lot of people understand, well, you know, there's nothing I can do for scars these days, but they're wrong. You know, there's a lot of good things that we can provide that's non-surgical, something that are non-invasive stuff to treat scars.
Okay, all the different kinds of scars. I mean, you've got these, you know, horrific things that happen to people create scars, but then there's really simple things like everyday things growing up, acne.
Yes, exactly. So there's different types of scars, and you can classify them in 4 different categories. You can have contracture scars, which are basically people have severe wounds or really big scars around their joints. You can have keloid scars, which are thicker scars. A lot of our patients have keloids after getting, you know, trauma or ear piercing even. You can have discoloration sometimes from scarring, which is very common in acne.
Oh, yeah.
And you can also have hypertrophic scarring, which is just a thicker scar after a surgery.
So it's interesting to see all the different pictures here that you can tell the difference in which ones are the easy ones to deal with and what are more difficult.
So there are different ways to treat scars depending on the type of the scar. So in dermatology, we use a lot of lasers, we use a lot of microneedling, you know, basically ways to treat the scars non-invasively, but at least improving the surface and the texture of the scar, or you can also improve the color of the scar.
You're talking about microneedling and lasers. Sounds scary to me. Is it scary?
No, it's very simple. It's something that we do topical anesthetic. It takes 10 minutes. It really does improve the appearance of the scar. Yeah. The most important thing is to get to see a consultation to see, you know, if this is a scar we can treat. There's a lot of things we can do these days. At Apex, we have our acne clinic, which is great. You know, we do a 360 approach to the patient, and we really, you know, treat them for not just for the acne, inflammatory acne, but for the acne scarring that they have.
You know, it's interesting because you help somebody out with something. It's really a psychological kind of cure too, isn't it?
Yes, and I also tell people, you know, the scars go a lot deeper than the skin.
Right.
You know, so that's one of the reasons we have the Purple Heart Project at Apex. I started that 2 or 3 years ago because of my military commitment and my passion for dermatology. So we provide complimentary scar revision for wounded veterans, and because I do believe that even if we can save one person, you know, kind of get them their mental health back to baseline, that's a win for us. So.
You know, you're talking about veterans, and this could go. There's a nice picture there. Who's that?
Oh yeah, that's me back in the day, a few pounds ago.
What kind of hat is that?
And some hair. But yeah, listen, that was a very great time of my life as a flight surgeon for the Marine F-18 unit. So
That's fantastic.
I'm very committed to helping out all the vets out there.
Hey, so a vet way back then, if he had a scar and he's living with it, and is there something you could do now, even though it's been such a long time?
Yes, and we do that all the time. So there's different things. You can do injections initially. You can do topical things like a silicone. You can do, like I said, there's a lot of things you can do for scarring these days. You know, if you have a scar that really bothers you, you know, just talk to us, get a conversation going. We can help you out.
People look in the mirror and they see a little tiny thing. It's a tiny thing. Maybe nobody else cares, but if they care, you help them.
We can help them out, and it's something that's usually not covered by insurance, but it really doesn't break the bank either.
No,
and
that's good news.
Yeah, it's something that's very easily affordable, no. And if it gets you back into the game, it's definitely worth it. So,
Dr. Garcia, thank you very much. And the good news is they have 11 locations, so easy to find them. Give them a call, and they'll take care of you.